Welcome back, everyone, to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And we are coming to you from a little change of scenery. We're at our place in Minnesota recording some PT Pearls, but today we're coming at you with slipped ribs, rib injuries. What might be causing that irritation in the ribs? Stick around. But what is the rib cage? And it's really this collection of ribs. Some are called true ribs, some are false ribs, some are called floating ribs. And we're going to kind of dice through what that all means quick.
Yeah, exactly. So the first through 7 ribs, this is technically called your true ribs because it's literally meaning it's connecting around from the thoracic spine all the way over to the sternum. And they're held together from our cartilage between the ribs and then the cartilage that's coming from the sternum and connecting them to the rib cage that way as well. Next week, ribs, that's our false ribs, meaning that no longer are they connecting into the sternum. So they're kind of held together more so just from the cartilage that is between the ribs and then a little bit from just some fibrous tissue. So they're thought to not be as tightly interconnected, obviously, because now they're not going directly from the rib cage to the sternum. They're now just kind of hanging out underneath the sternum. And this is mainly where we're going to be kind of addressing and talking about mainly where people start to feel this kind of pain. And
then the last ribs, 11 and 12, tend to be called floating ribs because they don't have any cartilage that then attaches them into the sternum. They're kind of the ones way down there that if you feel, you can kind of just feel them floating there.
When they say slipping rib syndrome, what they're really meaning is that lower part, again, going back to those false ribs, so not necessarily attaching into the sternum, and they're just really saying that the cartilage, not necessarily the ribs itself, but the cartilage has now moved or in terms slipped is the verbiage that they're using. Yeah. And it's causing some irritation at the nerves that go into that costal cartilage. What they found is what is the cause of this, right? Why does this happen? And the majority of what I was reading is that it's just, they can assume that it's just maybe it's hypermobility of the body and it's causing this hypermobility of the rib cage, which is allowing it to feel out of place, allowing it to feel a little bit more irritation maybe into those nerves, or those muscles having to work a little bit harder. And so maybe there's possible strains or pulls and things that you're feeling extra around that area. And also the causes can come from traumatic injuries. So especially if you're in a sport that is very high impact and you get hit in the ribs a lot, that's when it would be more beneficial to get more imaging. So especially if you're doing some of the exercises we're going to talk about and you're not seeing any kind of improvement, and maybe you notice a change after you eat a meal, a certain type of meal, or you do whatever it may be, there might be other things that are going on. That's all we're saying. And that's why sometimes going to get extra testing, going to talk to an MD about your symptoms and what you're experiencing and when you're experiencing them can be very beneficial.
And I mean, not even an MD, but a PT is trained to be able to differentially kind of diagnose, is this coming from rib inflammation? Is this coming from something that is mechanical? They'll do a lot with you with breathing. They'll have you do a lot of movements versus might this be something that is referring from our organs, which is some of the things that we just laid out. And if they kind of determine I'm not noticing that this is something directly coming from your ribs, why don't we head over and go see your primary and see if they have any thoughts?
Baseline of everything that we always talk about, almost every podcast, is the breath. Because if we're going to get that diaphragm to move up and down, what has to happen? Our rib cage has to expand and compress. And it's going to make those muscles around the rib cage move. It's going to make the cartilage between the rib cage move and expand and change in different ways. And sometimes, especially if you're having a rib issue, deep breaths are not going to feel comfortable.
Generally what I say, hey, if you're breathing to your comfort and doing something that's not going to irritate you for, a day or more afterwards, you can always explore with your breath. And that's always a good way to start. Like you said, getting that rib cage to feel like it can expand a little bit into that discomfort. Exhale to get it to contract a little bit down, using that diaphragm in synchronicity with our transverse abdominis, that big core set that we have that literally tightens those ribs up for us a little bit to give us some stability. That's an amazing place to start.
The most diagnostic tool that we have is just the hooking maneuver. And that's taking the hand, going underneath where it's painful, and gently pulling upward, or like anteriorly to the front of your body. A lot of people cannot even get their fingers underneath the rib cage. So already, without having to pull or do anything, that's painful.
Yeah.
Who's ever getting their stomach massaged or their rib cage massaged? Like, we don't even get a lot of feedback to that area and a lot of stimulation. So already the hook is going to be painful.
Just to give a couple examples of ways in home that you can feel this. And I think that one of my favorites, I learned this from you the first few times I saw you do this, is taking a band. If you just have like a longer cut of TheraBand, and wrapping it a time or two around your low rib cage. Find kind of where those ribs end, go up a few inches and just wrap it around those low ribs and just sit there or lay on your back and do some breaths and feel how that changes your feedback of feeling, oh wow, I can feel my ribs pushing out into that band now and trying to expand. And try to just focus on expanding against that band and letting it help you contract down, and expanding against that band and letting you contract down, and just doing that for 5 minutes and then taking the band off and then repeating what you were just doing to see how it changes can be pretty eye-opening for some people.
We as therapists provide for you exactly what Dom was talking about earlier. We provide that support and stability so that the system feels safe, so that it can start to gain more motion. That's all we're trying to do. We put hands on you as we move. Like, you might notice that there are some rib mobilizations that therapists can do as well. And all we're doing is we're providing support, stability, and taking you through safe ranges of motion. And so you can do this in your body as well. Even laying on your back provides a support. It provides that wall of safety for your body. And then you can start to place your hands on your ribs and then move around as you're on the floor. Even that provides more just feedback to the brain that says, I'm safe, it's okay, and I can move a little bit. And then you try those breaths exactly how Dom was talking about into that lower rib cage as you breathe and move and slow down that breath, so that again, we're creating safety. Safety is the messages that we continue to report into the body. And you only move within what your pain tolerance is. And you might notice you do this for a few weeks, you're going to increase your range of motion.
So I guess that if we're talking earlier stages, we talked about starting on your back.
Yeah.
A place that's kind of classic to start is like alternating heel taps. But again, doing it with this band, I promise it'll feel different. Yeah. Because especially if you're somebody who's like, oh, I'm not sure if I'm doing this right, the band will help you find that stability and work into basic alternating heel taps, then straightening legs, doing things like that. And then we can progress to standing or different positions.
Yeah. And I like to doing, if you're laying on your back and you do a bridge and then you kind of reach one hand over to the side of the opposite shoulder, kind of over to the floor, and then coming down, bridge and reach over, you kind of get that rotation through that lower rib cage area. And your body's going to want to extend a little bit. So you're going to need to keep active to prevent those ribs from, because I know as soon as I want to go overhead, my ribs want to flare out. So it kind of helps to control that core area. You're getting the glutes to work. So you're starting to get things kind of back in place. You can even flip over onto all fours, do some cat-cow. You could do some quadruped holds where you kind of hover the knees kind of barely off the floor when you're on all fours. Or you can even do some thoracic rotation, whether you're in child's pose and you're getting that elbow to kind of lift up, or you're in quadruped and you're kind of getting that rotation. So getting back into our thoracic controlled extension and rotation is huge for the rib cage. And then when we're progressing a little more, getting into a half kneel, or having one knee down, like a Pallof press is a popular one where you're just staying in a stable position. Something's trying to pull you into rotation and you're needing to keep that, different lift exercises that Jen and I show a lot of times, where you're kind of, like she said, you're reaching up and away from a chop. Yeah, like a lift or a chop. Those, again, they're getting you into that extension, rotation, flexion, rotation, and commanding some more controlled stability from our rib cage, the core. How do you combat that? Lift.
Yeah.
Gain strength. Feel strong in the body. Yes, you want to do core. Yes, that's important. And building overall strength. Like every time we do a lift, a squat, a deadlift, you have to maintain your pillar. And so that is already core. You don't have to do these Pilates looking exercises in order to get core. You do it just from lifting something heavy, carrying groceries in, carrying your kid. Like these are all core exercises as well. And so if you're continuing to repeat this pattern of slipped ribs, I think we need to address, well, what are you doing in your exercises that are helping to maintain what your body is feeling stable and safe with as well?
Absolutely. If yoga is the thing you do the most and you're having this issue, yoga is probably not the thing you need to do more.
Yeah.
If lifting and doing strength training is the thing you do the most and you're having an issue like this, strength training and lifting more is probably not the answer. So that's where look outside of what you currently do to maybe find that thing that supplements and complements what you already do really well.
Thank you so much for joining us for another educational physical therapy Pearl. I hope you guys are learning so much, feel better and safe within this amazing body and rib cage that you have. If you have more questions, drop them below. And if you have suggestions on what you want to learn or different diagnoses that have come up, comment, let us know, subscribe so you don't miss any in the future.